This is an elective activity on evidence-based practice breastfeeding solutions for the BSN class 381. The outcome for this presentation is that at the end of reviewing these clinical scenarios, you will be able to evaluate and access breastfeeding resources and implement solutions for breastfeeding families in clinical practice settings. Record. Your objectives for this presentation are to be able to evaluate at least 2 breastfeeding resources for nursing mothers and families, interpret laws supporting breastfeeding mothers at their place of work, locate a breastfeeding resource near your place of work or home, and then be able to select at least one opportunity for lactation continuing education for healthcare professionals. So in this presentation, you'll be given 5 scenarios. You'll view those and you'll be given questions to answer related to nursing staff communication with Erica and her family about her desire to breastfeed her baby. And you will be asked to comment and think and reflect on the videos. After viewing each video, you should choose the best answer for how the nurse should respond to Erica based on evidence-based practice. Erica on the right is a 28-year-old female with a history of mild coarctation of the aorta. She is otherwise healthy. She's pregnant, which puts her at risk for heart issues related to increased blood volume and bicuspid aortic valve dysfunction. Erica's meeting with her cardiologist on the left about her pregnancy and heart condition. The physician congratulates her on her pregnancy, and Erica states that she's very happy but acknowledges the cardiologist's concern. The cardiologist states that they've discussed how pregnancy can affect her heart condition, that they'll monitor her closely and hope for the best. He reminds Erica that she may need a surgical procedure in the future. Erica appreciates his concern and thanks him for looking out for her. Question 1. What resources can the office nurse at the cardiologist's office refer Erica to? There's internationally board certified lactation consultants, or IBCLC, lactation educators, breastfeeding classes in the community or hospital, La Leche League, breastfeeding peer counselors at the WIC office or the health department, or Breastfeed LA? And the answer is all of the above. Oh, wait a minute. What do these terms mean? Well, a breastfeeding peer counselor is a woman who's had a successful breastfeeding experience, and they're interested in supporting other women in their community to nurse their babies. They attend a structured class at the WIC office. Question 2. What resource personnel can the office nurse consult with? International Board Certified Lactation Consultants, or IBCLC, lactation educator, breastfeeding class in the community or hospital, Question 3. Where can healthcare professionals go for continuing education for lactation management or lactation courses to continue your education and learn more about breastfeeding management? And the answer is there's many resources that you can access to have continuing education for lactation management. So the University of San Diego Extension has a lactation consultant certificate. And I have the links here so you can click on them and see what they have to offer. Local health departments, the WIC offices, they have the Breastfeeding Peer Counselor program, which is offered nationally. And they have really amazing resources that you can access. And they're supposed to and this slide has CAPA and the International Lactation Consultant Association, and they have great programs that they offer internationally. You can get that. And then there's WellStart. And all the links are here. You can click on them and look at them at your leisure. But all these 2 pages of slides here offer a lot of information for continuing lactation education. Erica enjoys a healthy pregnancy and delivery, but exhibits increased cardiac symptoms related to her coarctation. She chooses to breastfeed her baby for the health benefits for both her and her baby. Here's Erica just after delivery asking if the nurse could help her with feeding her baby and checking if the position of her baby and her breast look correct. How do nurses help women like Erica with breastfeeding with their new baby? It first starts with nursing assessment. Have they breastfed before? Did they breastfeed successfully? What's their family culture? Do women in their culture breastfeed? Do they, they want the health benefits for themselves? You have to do a total assessment of their motivation behind breastfeeding, and then assess the woman's breast. How is she holding it? Is she holding it, her breast, between her thumb and her forefinger? How is she offering it to the baby? Is the baby's mouth wide open? Are they sleepy? Has the woman been medicated? Is the baby sleepy? These are all things that you have to assess. How's the baby suck? So those are different ways that the nurse can assist with breastfeeding and first attachments. Skin-to-skin contact is so important for the woman and the baby to have immediately after delivery. The nurse should assist Erica to hold her breast so the baby can attach. Observe that the baby opens their mouth wide enough so that the breast with the nipple and areola go into the baby's mouth. The nurse should assess the baby's mouth position and encourage the mother. The baby's mouth, when they should be wide enough so it opens and the nipples should go all the way past the hard palate to the soft palate in the back of the mouth. Here's a video from the World Health Association that you can click on, and notice how the baby, soon after they've recovered from delivery, about 15-20 minutes, actually crawls up. So say you're a nurse in the hospital and you have a mother who's trying to breastfeed and it's taking a lot of your time, and you have other patients. What resources are available? Question 3. Are there educational resources that the nurse can reference or study or read through to prepare to help patients with breastfeeding? And the professional term for breastfeeding education is lactation management. So what are these resources that you could access? I'm just going to go over a few resources for professions, and maybe you can find more resources. So I look forward to finding out what you find out. But I'm just going to go over a few that I find very helpful. Ruth Lawrence's book, Breastfeeding: A Guide for the Medical Profession, is very detailed and will give you a lot of technical and scientific information on breastfeeding, and that is like a great reference book. The Womanly Art of Breastfeeding goes through, it's the Leche League Bible, and it goes through the series First Attachments, lactation management, nutrition and weaning. It goes through their categories of things, and it has stories from women that of overcoming difficulties, all those different things. So that's kind of a feel good, and it's written in a way that's very affirming and encouraging for women. And then I put the breastfeeding peer counselor information in the link here. And that's from the state of California. And again, that's a program that's offered nationally. But the state of California breastfeeding peer counselor information on the web is amazing. It's very detailed. It goes week by week, and it's really good. And then there's also the Surgeon General's call to action for nurses and healthcare professions. And that link is at the end of the reference section where you can find that. Question 4. What resources are available in the community that the nurse can refer Erica to for lactation support after discharge? This is really important, especially if no one in their family or their social group breastfeeds, or if they need encouragement. And you will find that the people, when they get together in a lactation support group, they tend to stay together as friends for a long time. My best friend is a woman we were friends in La Leche Lake. So you'll find that this is the community support and the social support for the breastfeeding family is really crucial for their successful continuing of breastfeeding. So here's a big list of all the community support systems that are available. There's the local community breastfeeding support group. You can just look up breastfeeding and your zip code, and that's how it works with Breastfeeding LA. You just type in your zip code and it'll give you the group in your area. And then some hospitals have breastfeeding support groups where people who just delivered will come back after a week or two, and they'll have a little breastfeeding support group with their breastfeeding educator or their lactation consultant. And then the breastfeeding peer counselor, they follow up at the health department, and they have little breastfeeding support classes there. And La Leche League, they also, you can look them up on the internet, and they're all over the place. And I bet you could find an additional breastfeeding support group in your area. And you'll find that even in the NICU, when the NICU babies, they're told to breastfeed and pump their breasts and get it all ready for their baby, and breast milk's important. And then when they go home, there's not that continuation of a community support or social support system. And so they stop breastfeeding and just go directly to formula. So it's very important for them to continue successfully for breastfeeding, to be able to link in with a social support group in their community. Erica becomes short of breath with mild exertion and presents to the emergency room. The nurse asks her about her symptoms and asks her to take a seat in the waiting room. Erica's baby Corbin begins to cry. Erica is asking the nurse if they have a place for her to breastfeed her baby. Based on what we've talked about so far and what we've learned, can you think about how the nurse should respond? What resources could they access? And what are Erica's options? The nurse has many options to take care of Erica and her baby. They can put Erica in a treatment room if there's one available. She can feed her baby in the waiting room if she's comfortable, but it looks like she would like to use a designated breastfeeding area. It looks to me like that's what Erica's asking for. Question 2. What evidence-based research supports the nurse's response? What have you learned from this presentation? How should the nurse respond? Who could they ask for help? What are the options you might think about? There are so many benefits for health for the mother and the baby that the Surgeon General, the Academy of Pediatrics, the World Health Organization, and many other institutions support the health benefits of breastfeeding. So if all these people and all the evidence supports the benefits of breastfeeding, the nurse should support Erica's choice of breastfeeding. Of course, she needs to have her heart condition checked, and that needs to be stabilized, but everyone should support a mother's right to breastfeed. And all these agencies have evidence to support breastfeeding. And I put the little links on there, and you might be able to find some other organizations and supportive agencies. Have you heard of any laws that protect a breastfeeding mother's rights? Have you heard of anyone who asked for their rights or asked if they could breastfeed and asked for the designated area? What are the legal implications for women who choose to breastfeed? A nursing mother has the right to breastfeed her baby in any location where the mother and baby are authorized to be present. There are state and federal laws supporting mothers who breastfeed. There's mandated rest times where they should be allowed extra time for their breaks so they can pump their breasts if they have to, or feed their babies. I know of a woman in the military who had a job, she fixes airplanes, and now she was given a desk job, so she is able to take her extra breaks that are mandated by law to breastfeed her baby and pump her breasts. And then also, if there's not sufficient breastfeeding accommodation by the workplace, there is a fine that the health departments are authorized to enact. Here's scenario 4, planning. Erica and her physician decide that when the baby's 7 months old, she'll have the surgical repair of her heart. She pumps her breasts after feeding her baby Corbin, so she'll have extra milk available for her baby if it's needed during and after her surgery. Can you think of any benefits of stored breast milk? Breast milk is the best food for the baby. The ingredients are easily digestible. Breast milk is easily digestible. It provides the first immunization for the GI tract. It helps protect the GI tract. It has the first immunization for the baby. It's not replicable by formula. And so that's why it's the best food for her baby. And it also, the milk of the mother changes as the baby's needs change. The first milk is colostrum, and that has special ingredients that help the baby. And then as the baby grows and the mother's milk changes, it comes into the mature milk. And then they'll actually, when they pump the breast, the mothers will notice that it changes as, during the time of day. It's different in the morning than it is in the afternoon. And then there's the first milk that comes out is a little thinner, and then there's the hind milk, which is a little thicker. So it's actually the perfect food for baby. What community resources might be available to support Erica as she thinks about surgery, storing her breast milk, pumping her breasts? Well, we've already talked about the breastfeeding consultants and educators and La Leche League and breastfeeding peer counselors and Breastfeed LA. And all of those resources can give Erica suggestions on how to store her milk and what's the best way to store her milk and how to get a good supply of milk. And also Medi-Cal offers free breast pumps prescriptions for those who qualify. And then I'm up in San Jose, and we have the Mother's Milk Bank. So there's some women who donate their milk, and they process it kind of like a blood bank. And then they use it in the NICUs for the small babies. Scenario 5, pre-op holding. It's 6:30 on the day of surgery. and Erica's in pre-op holding. Having a plan for breastfeeding mothers is part of a comprehensive nursing care plan. Okay, team, this is our timeout for Erica Smith, birth date 2/17/1987. She has no allergies. She's scheduled for repair of her coarctation of the aorta. This procedure is scheduled for 4 hours. She will go directly to CVICU and be fast-tracked for extubation. She's breastfeeding, so we need to have her feed her baby now. Her husband will pump her breasts in CVICU while she is intubated. The plan is to fast-track her for extubation, so she can feed her baby soon afterwards. Are there any anesthesia concerns? No concerns. We won't use Versed. According to LactMed, the percentage of anesthesia medications that are found in breast milk is negligible. Versed is a longer-lasting benzodiazepine that's not recommended with breastfeeding mothers. Okay, so the plan is for you to feed your baby here in pre-op. Your husband's to pump your breast in CVICU. Then when you're extubated, you can feed your baby if you feel like you're up to it, and the physicians see that you are stable after the surgery. Oh, that sounds good. I know you'll take care of me. I should probably feed her now. This scenario could be typical that you might find in short stay surgery or ambulatory surgery or one of your patients that's going to surgery. Seems like the pre-op team had a pretty tight plan. They understood her needs, her physical condition, her emotional needs, and they performed a timeout in an understanding manner. How should the pre-op nurse respond to this scenario? Of course, since this is an educational tutorial and scenario, this is an ideal situation. So Erica's pre-op plan included breastfeeding her baby in pre-op, and her partner would take care of the baby. So think about the different social situations you might have where you'd have to think about the patient's social situation and resources they have. And the nurse should assist as needed and make referrals. I don't think you would get to the referral part right at pre-op, but if you were in the office or a friend or a colleague, you could give advice on or referrals on social assistance. Oh, you might have noticed in the time out that it was indicated that Erica's partner would pump her breast while she was still intubated and asleep. What is the advantage, do you think, of her partner pumping her breasts? This is a really busy slide, but I'll try and clear it up for you. So breast milk processing in the hospital is similar to how blood is processed. If Erica's partner pumps her breast, the facility paperwork is bypassed. Many hospitals have strict rules that follow the Center for Disease Control and Prevention guidelines for breast milk storage, in addition to facility-specific protocols for correct identification of breast milk, collection, storage. Scenario 6, extubation. Erica is fast-track extubated in CVICU and asks about feeding her baby. How do you think the nurse should respond after Erica's extubated and asked to feed her baby? Of course, you'd have to go through the nursing assessment. How's she feeling? Is she in pain? What's her mental state? And how much help will she need holding the baby? How much support will her partner need? As more and more high-risk pregnancy women are being cared for in intensive cares and regular hospitals, we have to think about the possibility of cross-training nurses. If you're taking care of a post-op heart condition patient, you may not be a lactation educator, or you might not have had lactation training or continuing ed. So the best options are to cross-train your nurses. Find the nursing supervisor. Ask them, how can you help me with this breastfeeding family? Where's the nearest breast pump? You have any breast pumps on your unit? Do you know where to get them? Where do you find them? Does our operating room need to have a breast pump available or attachments available? Or do we just borrow one from the maternity floor? What is the lactation support services at your facility? What information or evidence-based research from this presentation can you remember that supports the nurse's response? What evidence can you cite or remember from this presentation that can support the nurse in caring for Erica? There's that Surgeon General's call to action, the World Health Organization, Ruth Lawrence, Breastfeeding for the Healthcare Professional, the American Academy of Pediatrics recommendation. Well, as we conclude this presentation, I would like to encourage you to reflect. Now that you've viewed this presentation, taken the pre-test, you'll be offered the post-test, and then I would like to invite you to celebrate the end of the semester, your final clinical assessment, talk about nursing support of breastfeeding. You will receive a breastfeeding pocket guide, a lovely certificate, and ice cream. So I look forward to meeting with you on April 13th, and thank you very much for listening to this presentation.